They are working on all of these programmes as we speak, and they would need to come back to you with specific answers on some of the questions that you have asked. But the grant for schools is a government grant which is ring-fenced for schools. We don't have any influence on it, and that is the money that we are able to spend on schools. We all need to lobby our whoever is in government in the future to spend more money on our schools. We are all aware of that, and indeed the leader went down to London himself with some head teachers in this past year to ask for extra money for our schools. So we are all aware of that. And we are doing the best that we can with the amount of money that we have at the moment.
Thank you. Councillor Longley, did you want to add anything on this?
The only thing I was going to add, I actually alluded to it earlier on, as indeed did Councillor Baker, and that is that the numbers that going up from 600 million to 634 in the next financial year.
Okay, thank you. Yeah, well, we know this is always an emotive area, and we try to work closely with our schools in our localities and all that. And I did, as Councillor Baker mentioned, we see the schools minister regularly, and last time we took some head teachers with us and we put the case for Northamptonshire, and we welcome the uplift that we've got. But of course, we know we still remain a part of that F40 group that campaign for better funding settlement for the lowest 40 funded authorities in the country, of which we are one. So we'll continue to do that and do what we can to lobby and get our fair share for Northamptonshire children. So, Cabinet, are we happy to agree with the report?
Yeah.
Thank you. So, item 13, Northamptonshire pause for a fresh start. Councillor Baker, you're going to introduce this?
Yes. Thank you, Chairman. Pause for a fresh start is a specialist intervention programme that works directly with women who have multiple children taken into care. The aim of this is to reduce the number of women who've already had more than one, who have had one or more children taken into care, who are considered to be at risk themselves of a pregnancy with the same outcomes. For example, having further children removed. This is a programme that we are very passionate about, because it not only will have better outcomes for children, but it will have certainly much better outcomes for the mothers of these children, because they are putting themselves at risk by having so many children themselves. PAUSE will provide a multi-agency approach to support Northamptonshire's very vulnerable women who have had more than 2 children taken into care, who continue to have complex and chaotic lifestyles. This programme aims to reduce subsequent pregnancies through contraception and give counselling and mental health assistance to those women who are involved in the programme. Northamptonshire has a significantly higher number of women who have more than one child taken into care, currently engaged in care proceedings or considered to be at risk of reoccurring pregnancy with the very same outcomes. The total outcomes payment costs are based on working with 2 cohorts of women, 24 in each group, and payments will be made on instalments upon outcomes, probably no funding at all passing over until after 2 years. And this will run for a 5-year period. As I said, the payments will only be made on the outcomes of the programme. We currently have indicated 300 women that would be eligible to take part in this scheme, and our staff are currently working very hard to find 50 of those who would be able to benefit from it and see it through to its fruition. This programme is working very successfully in 30 other councillors, 2 of whom I've spoken to over on the telephone in the last week, just to make sure, and it will be funded from public health grant funding. This is a public health funded reinvestment programme which will run for 5 years, and payment will be made, as I said, by instalments. And really and truly, the real outcome, the real reason to do this is to make for a better outcome for these vulnerable women who are putting themselves at risk by having more children than they can look after. So recommendations to Cabinet are to agree the delegated authority to be given to the Director of Public Health in consultation with the Cabinet Member for Public Health to procure a national pause programme locally for the benefit of Northamptonshire's vulnerable mothers and children. And number 2 is to agree that the pause programme can be directly awarded to a sole provider via a social impact bond and for a period of 5 years. Thank you.
Thank you, Councillor Baker. Okay, we've got Councillor Stone.
Thank you, Chair. I've got an awful lot to say on this, so forgive me if I can't get it all in. I was with a foster carer the other day who was looking after a baby with fetal alcohol syndrome, who was the 7th child that had been taken into care from her family. It was heartbreaking. And so I was delighted when I saw this programme coming forward, but I have got a lot of questions to ask about it. So in the first paragraph, it says the purpose of this report. It gives us all the indicators that you've just explained, but it doesn't say why. And, you know, if we're going to, I agree with this programme, but I think we also need to address the reasons why families and women end up in this situation in the first place in higher numbers in our county than anywhere else. I really think we need to do that. I think it's really important for us to note the results of the evaluation from the University of Lancaster, which is really, really clear about a number of issues. For example, the caseload per practitioner has to be kept very low to ensure a good outcome. It means that the practitioners need really good management support and really good clinical supervision. That doesn't come cheaply. It needs to be absolutely guaranteed. And I'm really worried that in the report there was a hint that we may want to deliver this in-house. I'm all for in-house services, as you know, but in this particular case, the recommendations are that it should be done independently from statutory services. I think that is a safeguard that we really need to fight for and really need to protect. In terms of the outcomes, of course, you know, we all understand that social impact bonds are an outcome-based provision of funding. It's not clear in here what the outcomes are going to be in order for the funding to be delivered. So I would like an awful lot more clarity for myself around that. We understand that the delivery of these services it's not just the kick that will be delivering, but the women's needs as they become apparent. We'll have a budget, hopefully, and their needs will be met by using a multi-agency partnership. We need to have more information about what that multi-agency partnership may look like. We know that women living chaotic lives, one of their issues for them is housing. So, you know, are we working with the districts and boroughs to ensure that their housing needs are going to be met? And similarly, women living in those chaotic conditions are often coming in and out of the benefit system. They're being sanctioned. They're having all kinds of penalties applied to them. That won't jeopardise this project if those women are subject to those difficulties. So something needs to happen to make sure that their lives, are in as far as we can make them,
If you could round off, Councillor Stone, please.
Are protected. Yeah.
But I think you've obviously got lots of questions, and it
Yeah.
might be worth getting some sort of briefing with an officer here. But
I think it's a good project, but we just need more clarity about some of the
Okay.
issues.
All I was just going to say was I think you'd agree, Councillor Stone, that if we can make a positive difference to 50 of these women, then we will have achieved an enormous amount. And I'm happy, if Lucy's happy to answer a few of your questions now, she might...
well, just hang on a second. We've got a couple more speakers, and we'll go through the chair.
Just hang on then, Lucy.
Prevention is better than cure,
Well,
though.
exactly. Thank you, Councillor Stanborough.
Lucy's happy to do it.
Yeah, not now though.
Thanks, Chair. I'll be brief. So I too looked at this and thought this can only be a good thing, and I sincerely hope it will be. Just a question on paragraph 3.8, where there are 2 bullet points. Is there an and or an or between those 2 bullet points, please?
Okay, we can check that. Councillor McGee, did you want to say something?
Thank you, Chair. I'll try not to be repetitive. I, like many others, read this and thought it's a good idea. It does beg the question why you're delivering it and not the Director and the Cabinet Member for Public Health, given that they'll be putting the money forward in the future for it. But I do have some questions. You're not the only one passionate about our women and our children about here. I'm sure we all are. And my information on it is there's 31 local authorities from Dundee to Bristol, which there must be some good practice along that line. And they all seem to be working in different areas because they will be subcontracting to other groups within Northamptonshire. I'm not sure if that's true, but that's where some of them are working up and down the town. So there'll be other voluntary organisations taking part in subcontracting. Is that going to work like that here? And Rick talks about savings, and I do believe it could deliver a lot of savings to other bodies, including ourselves, including public health, CCGs, local authorities. There is a great opportunity to get the savings, but that would be on the outcomes, and given that, you know, the numbers we're looking at, there'll be, if it was running like other ones, there'll be a 16-week evaluation of women before we ask them to take the appropriate contraception, whatever that may be, before we ask them to go on that programme. So what is the success rate and how many women and children involved do we need to make these savings? And does that amount of savings mentioned here depend on the success rate of putting people through the full programme? Because we do want it to work, Chair. I'm not decrying this. I think it's a good idea, regardless of often perhaps you've got a view yourself. A select committee actually said there were some ethical problems with this, and I know some MPs do think there's some ethical problems with this. I personally think it's a good way forward, and we could make a difference to the women and the children within the county. So perhaps we can have some answers, please.
Okay, thank you. Okay.
I just first of all...
Hang on. We'll ask Councillor Morris, because his name's on the paper as well, if you'd like to make any comment and address any of the issues brought up there.
That's why you won't need...
I'll get it.
Thank you, Chair. Obviously, this is a joint paper, so we're both presenting it. It was just that Councillor Baker, particularly because of her interest in children's area, thought that she would start off proceedings, but obviously I'm very, very happy to support this and the work that it proposes to do. I think I heard from everyone a general consensus that we're all very pro this work, so I think that's a good piece of information. In terms of the detailed questions that you've asked, I may ask Lucy if she wants to answer those now, or we could come back with answers on those, I think, because they were it's quite a long list of questions, unless you particularly want Lucy to comment.
Yeah, no, I think we can come back to some of those. I think
so, because they were quite complex questions, and we're certainly we want to make sure we get the answers right, but generally obviously very supportive of the work that public health do. Often we don't talk about public health, and we should talk about it more, because it is money that comes directly from government. And our Director of Public Health, of course, he does a great job looking for where the money can best be used, and I think we need to just reflect on how good the use of that money will be. And it does straddle both children's and adults, so that's quite obviously why we've got it as a joint paper. It was just felt that Councillor Baker was more, well, not more passionate, because we're both passionate about it, but we felt that she would want to lead on it on this occasion, but very, very supportive of the paper. Thank you, Chair.
Thank you. Councillor Naden-Hawley, did you have a comment?
Yeah, I think anything that educates women in the fact that they do have a choice when it comes to having children, and we all know that education is key to this. So anything, it's not always about, contraception, it's about the education and the fact that they can have a choice. And this 18-month programme will give them the time to reflect on that pregnancy and whether they want to have another baby so soon. The work that was done at the research that was done through the university, I think it was Lancaster, wasn't it? There was 11,000 women had more than one child removed between 2007 and 2014.
1 in 4 women who has a child removed through a family courts procedure is likely to return to have another removed, and the number increases to 1 in 3 if they are a teenage mother. So anything we can do, and I really want to celebrate this, and I think we have to take ownership of this as a Cabinet, and I'm sure Cabinet will agree with me that going forward we will see a marked difference in the amount of children that are removed from their homes. Thank you.
Thank you. Did you want to add anything, Councillor Baker?
I just wanted to say that although we are obviously all here concentrating on the ratepayers' pound, the outcomes for this are vital for the people first in my book, and the savings are second.
Thank you. I just wanted to mention as well, Councillor Cecilia Levin-Swift, when she was in Cabinet, she spoke about this a number of times, and we all are very pleased that we've got a very good programme here, and I think we'll all be keen to learn some facts and figures as it develops, and whether we can bring something back or we can find a way through Councillor Morris or Baker to report back on this. So Cabinet, we happy to agree the report? Thank you. So we need to move. Do I need to read something out? Monitoring officer. No, it's not there. This paragraph here. So I need to read this out, that under section 100A of the Local Government Act 1972, that public be excluded from the meeting for the following items of business on the grounds that if public were present, it would be likely that exempt information under Part 1 of Schedule 12A of the Act, the descriptions against each item would be disclosed to them. So, yeah, Cabinet, do we agree that resolution? Thank you.